Years of dealing with the pandemic, kids and teens are seeing even higher rates of depression and anxiety, and emergency rooms are seeing more young people who've tried to self-harm. News 8's Richard Allen shows us how our schools are taking on the challenge of helping kids in a mental health crisis.
Well, that's right. The American Academy of Pediatrics recently declared a national state of emergency in children's mental health, and California schools are responding.
We are definitely seeing higher incidences of depression. We are seeing a lot more anxiety.
Child psychiatrist Dr. Gaurav Mishra is chief behavioral officer for San Ysidro Health. He says the disruption caused by the pandemic to schools has had a profound impact on our children's and teens' mental health and their ability to seek help.
Many kids are waiting much longer, or their symptoms and illness is progressing a lot further before they get help.
An issue seen throughout the country. The CDC reports a rise in the number of ER visits for suspected suicide attempts by adolescents, especially girls.
We know that the pandemic has had an impact on all children and on learning, but we know that our students are resilient.
California's Superintendent of Public Instruction hopes to tackle these issues head-on, proposing Wednesday to bring 10,000 additional clinicians to California's public schools.
And having these mental health experts placed in schools, we're hoping that children will find these resources to be much more accessible.
Raquel Harriet is with Family Health Centers of San Diego, the county's largest provider of outpatient mental health services.
I think once we destigmatize mental health, children are a lot more likely to go out and seek resources.
And to that end, state legislation has also been proposed to include mental health education as part of California's public school curriculum at the elementary, middle, and high school levels.
That education piece, I feel, is really going to go a long way in making it okay to talk about it, and also sort of make them feel they're not alone in this.
And this proposal to add 10,000 mental health workers to California schools is projected to cost $250 million. While the funding source isn't clear, legislation on this is expected to be introduced in the coming weeks.